Welcome back to Holistic Healing Association. I'm Erin D'Arcy. I'm certified in embodied processing and clinical hypnosis. On September 10th, people gather in communities across Canada and across the world to show support for suicide prevention efforts and to remember and celebrate the lives of those that have died from suicide and comfort those who grieve the loss and loved ones to suicide. Personally, I know 3 people that have passed away from suicide. I would like to take a moment to reflect and remember the lives lost from suicide. Today, I have with me Doctor Nick, who is a clinical psychologist and certified in somatic experiencing. We will discuss suicide, nervous system health, and self-harm. Self-harm is very common in children and is significantly more than people are aware of. There can be a stigma to suicide and self-harm that can prevent people from reaching out for help. Today, we would like to start to take down these walls and break down the stigma of suicide and self-harm. Dr. Nick will be talking about his own personal experiences. Thank you very much, Dr. Nick, for joining us. Just tell us a little bit about yourself and your practice.
Yeah, thank you so much for having me back. It's wonderful to be back for a second time with you. So I am the owner and founder of the Integrative Trauma Collective. We are now a worldwide organization. We have 4 branches as part of the Integrative Trauma Collective: therapy services, clinical therapy services in the state of California. We've also recently added coaching and wellness, which is worldwide, which includes trauma yoga, breath work, somatic experiencing, nervous system coaching, as well as workshops and presentations for parents, for educators, for coaches, and we've recently added corporate consultation for leadership. Our practice was founded on the elements of trauma and trauma healing. So every member of my team has a strong foundation with trauma-informed care and understanding that every single trauma is different and every single trauma requires us to provide a modified, specialized individual plan for everyone. And our practice does work with self-harm. It does work with survivors of suicide. And for me, this is a very personal story and something that I really felt was a good time to introduce out into the world, especially with everything that's going on with, youth suicide hotlines being shut down by this awful administration, and just the amount of people that feel so helpless and so hopeless, because that is one of the hallmarks of suicidal thoughts that drives a lot of this, drives a lot of the suicidal ideations and behaviors, and a lot of the self-harm, right, can stem from these feelings of helplessness, hopelessness. And as someone watching so many people suffering through trauma right now, it felt like a good time to share my story and try to break some of the stigma.
And what brought you to the point of speaking so openly about being a suicide attempt survivor?
This is this is the first time that I've openly discussed it with someone who's not my wife. Uh, I am so fortunate now to have been with my wife now for almost 3 years. Our 1 year wedding anniversary will be coming up on New Year's Eve of this year, which I am so excited about and feel so happy about. The reason why it feels for me now that it's a good time to discuss it is I'm on the other side. I'm on the other side, and that feels so hopeful. And as a therapist, part of my job is to instill hope in people that don't have it yet. I tell clients, even if you cannot feel the hope, I will hold the hope for you until you're ready. They'll be right here with me. And I'm going to help you try to get to a space where you can have that hope too. And I think one of the hallmarks of somatic experiencing is to live with curiosity. And curiosity is parallel to hope. If you're hopeful, you can be curious about the future, about what's going to happen, about what your life could be. And for the first time in my life, after being with my wife and experiencing what love can be and what love should be, every day feels like a gift with her, and every day feels like a gift that I get to be here on this planet and help people and provide services and provide support. And for the first time, I'm scared of dying. And that hasn't been true for me since I was 12.
Wow.
And for me, that is the biggest sign that I am now on the other side of this. That this is something that will no longer control me, it will no longer influence me. And I want to share that story with as many people as I can, because suicidal thoughts, suicidal ideations are wrapped so tightly with helplessness and hopelessness. And it's felt so hopeless during when I was in it. But now being on the other side, sorry, my cat, cat, cat hair in my mouth. But
Oh,
I'm
that's
glad that,
always
yeah,
delightful.
I'm glad that he's here with me. But yeah, being on the other side for me is a strong indicator that, okay, now it's my time to share what I can. I won't share every detail of the stories, but share what I can with the hopes that other people can benefit from it, or other therapists can benefit from it. Because especially if you're a therapist working with suicidal thoughts, suicidal ideation, self-harm, it is very difficult. That is one of the specialties that I've kind of fallen into. It's just because a lot of my clients ended up having severe suicidal ideations, several attempts across my career so far. Luckily, have not lost a client. But as a therapist, it is very hard to work with, and it's very challenging, and it's very draining. And I think therapists need more skills and more avenues to work with this large of an issue.
Because it is a large and it
Yeah,
is.
it
And
is. It's huge.
I don't think people realize the amount of people that do self-harm and
Mhm.
do contemplate suicide, even within children.
Yeah,
The amount of children that are self-harming is devastating.
yeah,
And
yeah,
it's all coming from a place of pain. And we really need to start to look at why this is happening and what we can do to help.
yeah. I agree.
And would you like to start telling us about your journey?
Yeah. So as far back as I can remember, a lot of my childhood is kind of blanked out. Um, but I think that my thoughts and desires of not being here started when I was like 12 or 13. Kind of that like early adolescence, before going into high school. And I can probably pinpoint a lot of it, or at least a big chunk of why it was so activated at that time, to my experience with a very religious school in which I felt like I was the outsider, was often picked on, was often bullied, um, for various reasons. And that, being in an environment like that day in and day out, where people are not listening to you, people are not caring about you, um, there is constant bullying. It drives that helplessness, hopelessness feeling. And I've been thinking back on a lot of my experiences, and for me, I can't put a thought to it or an emotion to it always, but I can usually put a somatic state to it. And I'm thinking about it just now about the chest tightening, the breath kind of quickening, going into that shallow breathing, and it brings up that panic that a lot of us feel just before we switch from the sympathetic fight flight going into the freeze immobilization, right? And that freeze immobilization feeling is accompanied by helplessness, hopelessness, preparation for death is part of that as well. And a lot of the suicidal ideation, suicidal behavior research stems from this idea of helplessness, hopelessness that drives these feelings. A lot of suicidal thoughts are driven by this helpless feeling that things are not going to get better. And this continued into high school and college for me. Never did not have an attempt in high school or college, but would self-harm from time to time, as just a feeling of, I need to get this pain out. And as a child, right, how do we get pain out then to experience it? And for me, I think that's where a lot of childhood self-harm starts to stem from, is I want to get this mental pain out. Let me experience the physical pain. And thinking about my own clients, there's one client in particular that I've been working with for many years now, who when he first came to me was very suicidal, has had two suicide attempts while we've been working together, but for the last year, oh, and many acts of self-harm, many acts, like multiple times a day of self-harm, but for the last year has not self-harmed at all.
That's
And
amazing.
there, it is wonderful. Uh, it is so heartwarming for me to see. And we discussed his self-harm, and for him, the self-harm was because he was so numb in his day-to-day life. He couldn't feel anything. He couldn't feel any emotion. There was no joy. There was no happiness. There was no sadness. It was almost too large for him to feel even the negative emotions. So that deep freeze he was in, he needed to self-harm to feel something. That's how he would phrase it to me. Is when I self-harm, I feel something for about an hour and a half to 2 hours. And I've had the privilege of working with so many wonderful somatic experiencing practitioners and so many wonderful somatic experiencing faculty, as well as because I assist the SE trainings here in San Diego, and people often talk about hacking our system. We find ways to hack our system to either come out of a deep freeze or to push ourselves into a deep freeze. And thinking about the self-harm with this person, that's exactly what he was doing. He was finding a way to hack his system to come out of this deep freeze, because that was the only way that he would be able to feel alive and like
That's amazing.
he mattered. And that was huge for us to find out for him, and for him to actually realize, oh my, this is what I'm doing.
That's the only
So
way he knew how.
yeah, that was the only way he knew how to feel like he was alive. And thinking about that, how many children, how many of us experience that throughout our life? I don't know if I
Many.
feel real. I don't know if I feel like I matter. I don't know if I feel alive. This helps me. And with my own story, my self-harm was very minimal. It wasn't to the level or extent of this client. And I noticed that it wasn't until I got married the first time that the suicidal thoughts and ideations and actions started to really ramp up. And I am in no way taking an opportunity to jab at my ex-wife at all. Um, we were young, we were very I don't know what the word is for it. We were young and we should not have been together. And I think my nervous system knew that. And my nervous system knew that I was trapped in a toxic relationship, a toxic marriage that I did not want to be in. And I should not have been in from the start. I think there was a very much a trapped feeling in there. And that's where the attempts began, is when that feeling of trapped and helplessness became so turned up, of, well, now you're with this person, and for some reason divorce did not come to my mind as a possible option. But that feeling of, I am trapped in this toxic relationship, I am not happy, I have not been happy for a very long time, and I don't see myself ever being happy with this person. And taking a moment to kind of put that out there into the audience is, how many of us have been in that experience before?
I have. Yeah.
How many of us have clients that have been in that experience before?
Yeah.
Right? Of trapped in a toxic cycle that we don't know how to get out of. And it was being trapped in that cycle that pushed a lot of the suicidal thoughts and actions. And it wasn't until, we eventually ended, that my most serious attempt occurred. And I'll never forget, it was January 1st. No, not sorry, not January 1st, January 5th, 2021. And it was a moment that changed so many things for me. I am glad that I did it. And I am glad that I did not succeed. And I want to be very
I'm glad too.
clear.
And I'm sure your wife is very glad.
Yes, my wife now, Amber, who's right here with me, is very, very glad that I'm here. That was one of the bonding moments that we had when we first started dating, is, sharing my story and her being so glad that I'm here, and having people around that love me, that are glad that I'm here. I've never shared this story with family. So if my family is listening, if there is a member of my family that is listening, I love you. And it was not something that you did. And it was not a fault of yours. And I think a lot of family members that have someone in the family complete suicide, that is a question that they ask themselves so often, is, did I do something wrong? What did I do? Could I have done something differently? Could I have seen this earlier? You get really good at hiding it. You get really, really good at hiding it when you're doing it for so long, when you're in it for so long. So if my family is out there watching, listening, I love you. There's nothing to worry about anymore. I came out on the other side stronger than before, and now I get to help people who are walking the same path. And for me, that is one of the biggest gifts of this experience, is that I can now truly help people who are experiencing the same thing. And for me, it was trying that last attempt that really shifted so much of my experience, because I woke up from the event and was glad that I was still here. And I took that as, okay, I can't do this again. I have to find a different way to deal with this. I have to find a different way, a different method. And a couple days later, I don't know if you can see him. He's black and he's blending in with my shirt. But I adopted and rescued my cat Roz and his brother Phoenix. They were a bonded pair of brothers at a rescue organization. And I was driving around with my little sister because I wanted a cat. I wanted something that would keep me here. Something that would keep me here while the pain was still here, while the pain was still fresh, going through this really awful divorce. The pain was still very, very evident, was still very there. And part of me just knew that I needed an animal companion with me. And that's what my cats became. And they are the most loved and the most spoiled cats. Spend way more money on them than I do on myself because of the gift that they gave me, because they kept me here long enough to find SE, to find a way to heal my nervous system, which eventually gave way for me to meet my wife Amber and to experience the joy that I had always dreamt of. So for me, the takeaway that I want people to have from this part is that sometimes we don't need large fixes because sometimes we can't fix it. There was no one on this earth that could fix the fact that I was getting divorced from someone that I thought I was supposed to be with, but ended up being just such a toxic relationship. That time just needed to occur, and it was going to take a long time. Instead, something as small as going to the pet store, going to this shelter, and adopting, rescuing two cats, something that people do every day around the world, is adopt, rescue, bring in an animal companion. That's what shifted the balance for me. And I will never forget that with them. And I can't show it right now because my cat is on me. But my first tattoo that I ever got was a symbol of that. So at the front there is an arrowhead, and then there's the little bit of the arrow. In the middle there is my black cat Roz with a semicolon. And for those of us who know what that means, a semicolon tattoo is a symbol of an attempt, or it's a symbol of severe ideation. But the semicolon symbolizes that my story is not over yet. And I will keep going, I will keep fighting. And at the end of the arrow, it's a little phoenix feather, burning phoenix feather for my cat Phoenix, to symbolize rebirth, to symbolize change. And the arrow itself is a symbolization of you have to be pulled back sometimes before being launched forward. And that was exactly what happened for me. Was pulled back by this experience, but was launched into something that I wouldn't trade now for anything. I have never been happier in my life. I've never been more excited to be alive. And to me, that is the ultimate gift that's come from this experience. So this experience for most of my life, although being tragic and being difficult, gave way to something so meaningful and so wonderful. And I feel so fortunate that I get to share that with clients, not telling them my story exactly, but sharing with them that there is hope at the end, even if things feel so hopeless.
And I think many people need to hear that, because often when we are in our darkest moments, that is when we lose hope,
Yeah.
and we can believe that life will never get better. but that is a lie that we tell ourselves.
Yeah.
And if we can start our healing journey, there's hope and there's healing. And Dr. Nick here is a perfect example of that. And when you look back, what was our emotional and nervous system state you remember the most vividly during that time?
Oh, love you too. I remember the most. So I've been, doing a lot more presentations about the nervous system and seeing that kind of curved line going from the sympathetic, fight flight and kind of the intense fight flight and how that gives way into overwhelm and going into the kind of the deeper freeze. I remember living just below that overwhelm line. Those of us who, it's called global high intensity activation, right? Where our nervous system is just on, it's stuck on every single day. We're living in this kind of fight flight scenario where everything's a threat, everything is overwhelming, there's anxiety every single day. And for me, what I noticed was that there was panic every single day. And that, looking back on it, is the biggest nervous system state that I remember from a lot of these kind of more serious ideations, more serious thoughts, and the actual attempts themselves was it stemmed from that panic. And that panic stemmed from being in a relationship that I was not supposed to be in. Right? When we're in a toxic relationship, we fall into this pattern of trying to fix it, trying to make it better, trying to say the right thing, do the right thing, right? And um, panic in our nervous system often makes us feel like, okay, I have to fix this. Whatever is happening, I cannot rest until this is resolved. And when there is no option to resolve it, no clear option to resolve it, let me rephrase. We go into overwhelm. And overwhelm is where I remember living most of the time, about half and half, right? Half was that panicked state. The other half was living in that kind of frozen, immobile state of having all the lights off, not going outside, not wanting to connect with other people, wanting to self-isolate, wanting to be by myself, um, feeling helpless, feeling trapped, feeling hopeless. And the nervous system state of that, right, is so collapsy. I think it's the way that I talk about with clients is that just that collapsed feeling of not feeling strong, not feeling confident, not feeling powerful, and not feeling like I could make any changes. And I think that's where so many people find themselves when they're in the midst of suicidal thoughts, suicidal actions, planning, is I can't do anything to resolve this. I don't have the ability, I don't have the knowledge, I don't have the connections, I don't have the friends, whatever it is, right? But that I can't was the definition for half of my life at that time. The other half was I can fix this. I can resolve this if I just try hard enough. Realizing that I can't and then going into that I can't and really living in that I can't is so devastating of I can't go on. I can't imagine a life where I'm happy. I can't even be happy right now. I can't reach out to friends. I can't take up time. I can't take up space. I can't be a burden to other people. And so many of my clients, when they start coming to me for this, are kind of trapped in that. I can't see any way out other than this. And sometimes that's how it has to be for a couple weeks, a couple months is okay, experience this, but there is more. Because nervous system states are not inherently stuck on or stuck off. They can become stuck on, stuck off. But through somatic experiencing, I was really able to start noticing, okay, this is the state that I was in during this time, and this is what helped me shift out of it. And my cats were the first big resource with that. He's now just so knocked out on me. He's this,
You're
yeah,
his resource too.
yeah, and that is why I highly suggest an animal companion, because there is no love like an animal that sees you as their entire world. My wife, I know, loves me more than anything and anyone. She just made a face to me. But, she has a niece that is really special to her. And she has, family and friends that are very special to her. But for my cats, I am their entire world. And there's something so connecting about having that kind of love. So my cats, I can't say enough about how my cat saved me. And how many people around the world have a dog or a cat
Here, two dogs,
that,
same thing.
yeah,
Like they can
yeah,
bring animals, bring so much healing. Horses, and I know
yeah,
like cats, dogs, and horses, they all have a different way they can help heal a person.
hmm,
Um, they all have a different way of doing it, but they can bring so much healing.
yeah. And that is when I really started to notice my nervous system start to shift. Is when I brought in this connection and had this connection with someone, because I didn't have that when I was in my first marriage. That connection was completely severed, and it became toxic, and it became something where I couldn't connect with anyone else anymore. And now that I'm in a completely different nervous system state, I'm in a completely different place in my life. My relationship with my family even is so much better because of my wife and because of my cats, because their love, their connection with me has shifted my nervous system so much where I can now allow in love and care and support from other people. So I think right now, even my relationship with my family, with my friends, is the best that it's ever been because of my nervous system shift.
And what helped you feel ready or safe enough to begin telling your story publicly?
My
I
wife,
think you just answered the question.
yeah, yeah. I mean, I think so. I think being with my wife, was such a big catalyst for so much of my healing, having that connection, but also having that as a hallmark of my healing. Because before, I was not able to allow love in. I was not able to allow connection in. And through somatic experiencing, through healing the nervous system, shifting my nervous system, I was finally able to allow safety and to allow joy. And I'm gonna define that a little bit more and kind of touch on that a little bit more, because I can imagine people listening to this that don't know about the nervous system and say, well, how come you couldn't just let safety in? Safety is safety. No, it's not. Safety is not always safe. When you cannot trust safety as a child, it's not safe. It's combined and connected with the idea of, if I mess this up, I'm going to lose it. If I make a mistake, I'm going to lose it. I need to wait and watch to see if the other shoe drops to tell me that I'm going to lose this love and this connection. My wife gave me the first example of true love for me that I was not going to lose if I made a mistake or if I made an error, if I left the milk out, right? Or maybe didn't fill up the pitcher. And that is what gave me the safety to say, okay, now I want to share this story. And also kind of coming into my own as a therapist and doing these workshops, sharing my knowledge with people and getting good feedback back that yes, I am important. And I think that is also a really big catalyst for this, is that I'm coming into my own as a therapist, as a healer, not in the shadows of mentors anymore, not in the shadows of training, but as my own entity and as my own person. And there's so much freedom with that. And there's so much energy with that. And there's so much autonomy and power that come with that. And thinking of autonomy and power, it is the exact opposite of the suicidal thoughts, the suicidal feelings. Those are trapped and driven by helplessness, hopelessness. And that's not who I am anymore. That's not my life anymore. And I feel so much more comfortable to share my story now that I know for a fact I am on the other side. There may be tinges of thoughts that come up every now and then because I think, I don't want this to become a political platform, a soapbox, but I think as someone who does not live in the United States, you have a third party view into what's happening here into this in this country. But this administration really just wants people to be scared. They want people to feel helpless and hopeless and trapped, and they're doing that by these constant attacks. Every single day there's something new that's under attack, and seeing that around me made me realize too, okay, now this is a good time, because I can imagine that the amount of people that are having self-harm thoughts, the amount of people that are having suicidal thoughts has dramatically increased because of this administration, because of what they're doing. The fear tactics, it's not something that I want to stand idly by and just kind of watch. So this is also my way of kind of helping with that, which also feels very good and a little bit rebellious, which is like, ooh, okay, yeah, nice.
And that's a very good point. And I'm concerned with the Canada government. CAMH has pushed them back with concerns of themselves. And if you're not aware of CAMH is, it's Canada's largest mental health hospital for people that struggle with mental health and addiction. It's also one of the world's leading hospitals for mental health. CAMH has concerns and has asked the government to pause to March 2027. Mental health is going to be added to the list for assisted dying. And when we have depression, we can feel like there's no hope. We can feel like the life is never going to get better. Dr. Nick is a perfect example that life can get better. There is hope. And this starts at age 18. Family will not be informed. It can take 90 days. They will check with 2 doctors or 2 health care practitioners, and they can move forward. Personally, there may be many people that disagree with this, but personally, I believe that if the government is going to be putting out money to help people that are struggling with mental health, we should be bringing in new healing modalities such as somatic experiencing, embodied processing, parts work, polyvagal theory. And we should be getting the people who are struggling, like Dr. Nick was, getting them help they need, getting them the healing that they need. Because not everyone can afford $200-300 a session, and it takes a long time sometimes to get that proper healing. At least a year. Would you say that for some people, Dr. Nick?
Yeah, at least a year to really set the foundations and really start to shift the nervous system because we're working with pain that may have been there for decades. And I say that not because of the money, not because of anything like that. It is more about what we're actually working with and what we're actually dealing with. The nervous system is such a complex organism, it's such a complex part of us. And oftentimes when people finally come to therapy, we're dealing with decades upon decades of trauma. It's not just, oh, this one event happened last week and that's the only bad thing that's ever happened to me. No, we're dealing with a lot and a lot of trauma. So a year oftentimes is a pretty good measure of when we start to really notice like significant nervous system shifts. The client starts to notice, okay, I'm actually acting differently during stressful times. And here in the States, insurance companies say, oh, you get 8 or 12 sessions and then that's it. No, no, that is a band-aid. That is never going to be enough time. And I agree that if resources are going to be put towards this kind of work, they should be put towards resources and modalities that can actually help with the body, with the nervous system, because it's still, I think it still hasn't been fully accepted yet. And yes, I think that stems from a lack of research, but the research is being done. It's shown that embodied work, somatic work is helpful. So 100%, I fully agree that with this scenario with CAMH, that they should be looking at adding in polyvagal theory, looking in adding in somatic experiencing, different somatic exercises, techniques before someone is able to really make that decision. Because for me, that was the missing piece. That was the special sauce, so to speak, that really changed things. I had been in therapy in and out for 5, 6, 7 years, but without the somatic piece, I don't think that I would have ever been able to really shift my cognitive stance on it.
And I believe a lot of people are not even aware
Yeah,
of the body work, the somatic work. That is, people like if I mention out in public somatic processing, most people don't know what it is.
yeah,
So it's in being informed, being educated, and how beneficial it can be. And same in Canada. Our healthcare will help people that are struggling, but only to a certain degree. Like you said,
mm,
8, 12 sessions. They may be able to book, a few more sessions, but it's not the in-depth counseling that we need, that the amount of people that need it. And most mental health struggles stem from trauma.
hmm
And give people a chance. Give people a chance to heal and start their healing journey because life is precious and it's valuable.
yeah, fully agree.
Well, you're the walking billboard.
I do love life now, and that's something that I never thought I was ever going to say. And to me, that is one of the biggest gifts. And it's a gift to be here with my wife and with my cats, and it's a gift to be able to do this job. I love life now, and that's a very, very odd sentence for me to say,
And
which is wonderful.
I believe there's many people that have been in your case that didn't feel like life would get better and it did.
Yeah, it did.
Can you describe what suicidal thoughts and impulses felt in the body?
Yeah. So looking back on it, oftentimes the panic is where it really started to begin during the day. And that panic felt first off like a pull. So it felt like my body was being pulled towards something, some action, some thought, something that I was hoping would help. during the day. So that's where I started to really notice the like impulse, and that pull turned into oftentimes like a burning sensation. Like I needed to figure out something. And panic, I think, is felt differently in the nervous system and the body. Some people experience panic differently than I did, and still do from time to time, right, based on what's going on. So that's, looking back on it, that's how I know that my body was in panic. And for people working with this kind of experience, or for people who are experiencing this, what I would suggest is naming that sensation, going back to it and really figuring out, okay, what is happening right now? What is this feeling? Because that intense heat in my chest and in my stomach, looking back on it, that was panic for me. And it was that impulse of something is not right. It was always this constant kind of feeling too, of just underlying fear of something is wrong, and I don't know how to fix it, and I have to be the one to resolve it. So that was the initial panic in my body. Felt very warm, felt like this sudden impulse to perform, to act, like I needed to run a marathon, but was sitting on my couch, kind of feeling. And then that hopelessness, trapped, helpless feeling is oftentimes where the bulk of the suicidal thoughts, actions, take place. And it literally felt kind of like my body was being strapped down. Like it didn't feel like I had the energy to exercise, to interact with other people, and I needed to make myself smaller. So oftentimes I'd walk around the house kind of hunched over, or my shoulders would be more hunched in. Oftentimes that's a big indicator of freeze in clients, is when their body is kind of more being pulled in. It's a sign of self-protection. We need to protect ourselves. And um, looking back on it, I had a very wonderful somatic experiencing practitioner that I worked with for a while talk about these suicidal impulses in the body as a disruptive protective response. That my body knew I was in a bad situation. My body knew that I was in a dangerous, potentially dangerous situation, and I needed to stop that pain. I needed to stop that fear, that intense sadness, and referred to the suicidal thoughts as, sorry, it's remnants of cat hair. He's gonna go eat now, but um, remnants of that suicidal thought as a un unfinished protective response. So we worked a lot with that kind of freeze, immobility, working with a controlled collapse, because looking back on it, that's what I really wanted at the time. Was I wanted to allow my body and myself to just give up and collapse, but to be taken care of during that moment. And that's what we were able to do during sessions, was to do a controlled collapse where I'm in control of how fast I'm collapsing, and I'm providing care and comfort and support to myself during that time. And looking back on it, that was what I desperately wanted during those times. That's what my body was trying to tell me, was we want support, we want care during this time, we want tenderness, we want connection, and it's just not there. And my best advice to therapists who work with this, to therapists who want to work with this, and to people experiencing this is, let's start listening to our body more. Let's start really analyzing and really figuring out, okay, what are these feelings? Because usually people just say, oh, my body's just feeling this, and that's it. But no, our body is always trying to tell us something when it has these different experiences. And I'm glad that I now have the ability to look back and say, okay, this is exactly what I was needing.
Many people think that suicidal thoughts are just psychological. In your own personal experience, how did your body carry or express the pain?
Oh, it expressed the pain through tightness in my chest, through anger that did not have anything to do with what was happening throughout the day. There was no reason for me to be upset or sad. Um, the body will always experience emotions first. You know, the body has a physical sensation, a physical experience. The information gets sent to the brain, and then the brain has time to say, okay, this is what I'm probably feeling. But also just thinking about trauma and thinking about being trapped, because that sensation for so many people, being trapped, being powerless, being helpless, is what is going to keep them stuck, right? That is going to be the re-triggering moment. And the way that the brain's structured, the prefrontal cortex, the second part that's eluding me off the top of my head, the limbic system in the third part, and then the brain stem here at the end. Our limbic system is in that third part here, and it does not communicate very well with the prefrontal cortex at the front, which is responsible for planning, understanding, deep critical thinking, deep thought. So when we are activated and truly stuck in that kind of trauma brain, we don't have access to our critical thinking. We don't have access to planning. We don't have access to logical thought. So that's why I'm a firm believer that somatic work, SE, embodied work is the perfect parallel to the cognitive work. Yes, DBT does a great job with these kinds of situations, but if someone is so trapped in that trauma cycle, they're not going to be able to really focus on the words. The words aren't going to fall on deaf ears. And that's what I remember the most is friends, family telling me that things are going to get better, try this, try that. Therapists doing the same thing, with like the traditional talk therapy, and it constantly failing. And the problem with that is I felt like it was something I was doing. Not that there was a missing piece that I didn't have access to, but that it was literally my fault. And for so many people, that is what also keeps us trapped in these thoughts is, well, we're trying these things. We're trying to think about better things. We're trying to be happy, but it's not working. So it must be something that I'm doing. And adding in somatic work allows us to shift around that. If the body's so stuck in freeze that it's not taking in information, then don't talk to them. Not don't end the session, but start talking to the parts of the body. Start bringing in parts work, start bringing in SE, start bringing in other somatic techniques so that you're able to speak directly to that part of the brain, the reptilian part of our brain that is responsible for fear. Because my entire experience was steeped in fear. It was so heavily connected with fear. And if we speak to that fear and allow the body to know, okay, in this moment here, you're safe, then we can start using the tried and true methods of DBT, of CAMS, of other different modalities that are specifically created for these types of events. Sure, but the body has to know that it's safe too, and DBT is not going to do that.
And why is it not going to do that?
So I've tried DBT before, and a lot of it is, planning, it's workbooks, it's worksheets, it's working on these different more cognitive based techniques, right? There are behavioral aspects of it too, but for the most part, those behavioral aspects are not going to shift the nervous system in the ways that somatic experiencing can, that other types of more somatic based modalities can. And I want to be very clear that I don't I don't see somatic experiencing as just one modality. I don't see it as just the way that a whole therapy session is done, because SE blends so well with other modalities that it becomes a different flavor. My flavor of doing SE is, psychodynamic, deep thought work mixed in with the body, mixed in with SE. And that is what I feel should be the first line of defense, is taking SE and blending it with whatever modality the therapist is skilled in. So if someone's coming in and doing DBT, yes, do the techniques, do the exercises, but take time, take moments to come to the nervous system and do the simple pendulation, do the simple orientation, do the resourcing, because that is not a core part of that work, at least not how it was done to me. And it wasn't until I started adding SE on the side, completely separate, that I was able to take in that other information a lot more. And for me, all of that stems from the fact that suicidal thoughts are so scary, and they're so damaging, and they're so corrosive, and they're so insidious. And for the most part, they are extremely isolating, because we feel like we can't share it, that we can't tell anyone, that we shouldn't tell anyone, especially men, and especially men of color. And that is one of the main reasons why I wanted to come on today and talk about this, because I want men of color and men around the world to know it does not make you weak to have these thoughts. These thoughts oftentimes are automatic. Our nervous system responses are automatic. And these thoughts do not stem from weakness. They don't stem from not being able to handle a situation. They stem from what your body's experiencing. And sure, I'm not the strongest person out there. I'm not going to go into battle, with like a Viking helmet and a sword, but I think I'm pretty strong. I'm able to hold so much trauma for my clients. And for these people, having these thoughts is not an indicator of strength or weakness.
No, it's
And
not.
unfortunately, that's such a hallmark of what men are supposed to be in society. And I don't think that that's necessary anymore.
And I agree. And I believe that's also touched on the book, The Myth of Normal,
Yep.
written by Gabriel Mates. And as a woman, I will tell you too, I believe strength is feeling our emotions,
Yep.
processing our emotions,
Hmm.
right? Being vulnerable.
Yeah.
That's true strength.
Yeah.
And I agree too with, I always hear it, somatics, embodied processing is the missing piece of the puzzle, because it's body work. It's
Hmm.
processing our emotions, working with the nervous system. And until we're able to regulate our nervous system, we're not able to cognitively understand it, to take it in. We need to be able to have a regulated nervous system.
Yeah.
Looking back, were there particular moments or triggers of those states that felt overwhelming?
Yes. So looking back, it's those moments of me trying to ask for help and being rejected or denied, not being believed, being told that, these thoughts are something that I could pray away, or that I could just think differently about it, and they would go away. That for me, looking back, was adding so much fuel to the fire, right? Because it's not, when you're in it for so many years, you try all these different things to try to feel better. people who experience suicidal thoughts and ideation, to me, are some of the most powerful people and strong people on this planet, because they try so many different things to feel better. Whether they're adaptive or maladaptive, I can't say, but it's something that will test you over and over and over again. And to approach someone, whether it be family, whether it be, a friend, and to say, hey, I'm feeling this, and to be met with, well, why don't you just try this? Or why don't you just try being happy? Or why don't you just try thinking about it differently? That's not going to help. And that is what increased the severity so much more, was being met with that. And I think part of that is so steeped and so tied in with the stigma that our society has around suicidal thoughts and suicidal actions. We don't want to talk about it. We don't want to deal with it. A lot of people are so uncomfortable with the very idea, but that is what's causing so much of the unmet needs, is because we don't talk about it. It's because it's so taboo. It shouldn't be. Again, this was a nervous system response. I didn't choose it. I didn't want it. It was automatic. And we shouldn't punish people for having these thoughts. We shouldn't tell them that they're bad or that they're not trying hard enough. They are trying so much harder than you think they are. We do not know what internal battle someone is facing every single day. And
I agree.
I'm wishing and hoping that we start to meet with compassion versus, oh, you're not trying hard enough. To me, that's what triggered the most of this.
Because when we can meet people with compassion and love, they so desperately need that, and support.
Yeah.
It's huge. That is a
Yeah.
huge part of for healing. It's
Yeah.
just finding love and companionship and support, because those are real life resources. And also finding meaning and purpose in your life can also bring a lot of healing and hope.
Yep.
And it sounds like your wife and your cats gave you exactly that.
They did. They did. And they helped me get to a place where I now am able to give that to other people. And that's a gift that I'm always going to adore them for, and something that I will always try to not pay them back, but reward them. Um, and it's finding hope in the little things. It's finding happiness in the little things, and finding what makes you truly happy in this world. And once you have it, enjoying it.
I agree.
Excuse
It's
me.
little things and little moments. It's not always trying to find it like a big fancy job. I
Yeah.
don't mean when I say purpose, I don't mean that purpose. I mean true, deep, deep purpose in your life and meaning.
Mhm. Yeah.
And how did you first come about somatic experiencing, and what draw you to somatic experiencing as a client and as a therapist?
I was working for a very wonderful community mental health nonprofit in Santa Monica by the name of the Wright Institute Los Angeles. If you're in the LA area, please go check them out. They do wonderful, wonderful work. No one is turned away for lack of funds. Usually people only pay 15, $20. That was the bulk of my clients at that time, was very low income individuals who needed help. And I was an intern. I was still a doctor at that point, but didn't have a lot of experience yet. And one of my supervisors there, Dr. Christopher Walling, wonderful man, and one of the most intelligent people I've ever met in my life, such a trailblazer, sat me down during one of our meetings and said, "Hey, if you're serious about working with trauma, you need to include the body. You need to include a bottom up perspective, because traditional therapy is top down, right? We work with the brain first, with cognitive thought first, and then we move our way down, is if that. SE, the bottom up approach of dealing with our nervous system first, our body first, and then going to thoughts, then going to the cognitive actions. Yeah, he said to me, you have to learn this in some way, shape, or form. And he highly suggested SEI, the Somatic Experiencing Institute, created by Dr. Peter Levine. And a couple months later, I started the training. And as part of the training, you experience the work, and you have to get personal sessions from providers. And that was such a gift as well, because it kind of forced me to do it, like forced me to try it, because sometimes it's scary, or sometimes we can't really afford it.
I was
Um,
exactly the same way. I went
yeah,
in and I was like, I'll practice on everyone. And they're like, no, no, no,
yeah.
you got to do it too.
But it's so important that we do it too, because then we feel it and
Oh,
we
it's so
experience
important.
it.
It's
Yeah.
how we learn and it's how we heal. And if we're not on our own healing journey, we're not going to be able to help other people.
No, not at all. And something that I loved about my SE journey and my SE experience is I got to practice with so many different people,
Exactly.
and experiencing a different practitioner, experiencing a different nervous system helped so much too, because it's like, okay, I get to see which nervous system matches well with mine. And that was a really wonderful experience too. Um, and I've never looked back. I assist now, which is a wonderful experience to help people take in this work. And as a therapist, my clients have done so much better since adding in the body. And that truly was the missing piece
And
for
you
me
see a
and for my
significant
practice.
difference.
Yes. Yes, I see a significant difference. As for example, with this client, we've been working together now for 2.5 years. When he first came to me, one of our first sessions, I would say maybe session 3 or 4, he came onto the Zoom call and said, "Hey, I'm going to kill myself after this session. I just wanted to say bye." And I looked at him and said, "Okay, can I have the rest of the session to help you figure this out?" And we did end up having to hospitalize him. We did end up having to, get him to a 5150 mental health hospital. But when he came back, we started to do a lot more SE. And we started to do a lot more work with the trauma that his body had been holding for so long that was terrifying. And I still see him to this day. He hasn't self-harmed in over a year. After self-harming multiple times a day for years and years, very long, very deep cuts into his body, he doesn't need that anymore because his nervous system doesn't require it anymore. And for me, that would have never occurred if I didn't understand the nervous system and understand how to work with it. So I credit SE with that person's safety and that person's healing.
Because there's always hope and there's always healing. And it's sometimes just meeting the right type of therapy that the person needs.
Yeah.
And being able to understand our nervous system and heal our nervous system is significant.
Yeah.
And what were some of the SE practices and experiences that shifted your relationship with suicidal thoughts?
The biggest one that took a lot of time to work with was the controlled collapse. And the controlled collapse is such a wonderful exercise. My SE practitioner would have me either keep my hands on my chest or keep my hands on the side, and just allow my body to slowly come down until it felt comfortable. And at first, I'd go down just just a tiny bit, and then more, and then more, and then more over time, over sessions. because it required me to do two things. One, it required me to let go of control. And for a lot of people, holding on to that control is part of the panic. If I don't control this, I don't know if I'm going to be okay. I don't know if I'm going to get hurt. I don't know if I'm going to lose something. I don't know if I'm going to be abandoned, rejected, what have you, right? So allowing ourselves to let go briefly of that control was so helpful. And then it became working with providing support and care during the controlled collapse. So holding myself, doing the different SE holds, the hand on the back of the neck, on the brainstem, having another hand on the forehead was one. Doing the, I call it the butterfly hug, where you just provide a
Oh, I
little
know
bit of,
that one. Yep. Yep. I
yeah,
use that one all the time in
yeah.
sessions.
So it's doing the controlled collapse, inviting then the self hug so that I'm the one providing support for myself. I'm not waiting for someone else to deem me worthy of it. The other one that was very helpful was the anger, was releasing the anger that I was suppressing during, the really toxic times of my last marriage, was being able to release that in a healthy titrated way. I think anger is one of those things that it often feels good when we kind of just like let it out. But if we let it out too much and it's too explosive, it doesn't actually do anything. It doesn't actually help. It just overwhelms our nervous system. So we're to where we feel good again, going back to that idea of hacking our nervous system. So what we did was she would have me make fists, release them,
Slowly.
slowly make fists again. And for me, there was a lot of shame mixed in with that anger. So working with that shame as well, right?
Mhm.
Of not blaming myself for what happened, not blaming myself for, having these thoughts, but just allowing that anger to be there, allowing that sadness to be there, and then allowing in the grief of the time lost, of the energy lost, and all of that working together allowed my nervous system to really shift in big ways. And SE is all about being able to expand capacity, to feel stress, to feel difficult things.
Exactly. And that is what healing is
Yep.
feeling the capacity, and our triggers start to become softer and softer. And even like repressed anger, many do not know, but it can lead to depression, deep depression.
Yeah.
And so if we can feel into our anger and not explode, but feel into our anger through somatic experiencing sessions, through embodied processing sessions, through body work sessions. But it's like turning on a tap a little bit at a time, because often people are afraid to feel
Yep.
into their anger because they feel like they could hurt someone because they have so much anger. They just repress it. They just push
Yep.
it down. But just allowing it a little bit at a time with a practitioner
Hmm.
can make a world of difference, and having that person there just to support you and hold presence, because presence, if you can have a therapist that can hold good presence, that can bring significant amount of healing.
Yeah.
And can you give a concrete example of what that looked like in the moment, how somatic experiencing using somatic healing processing helped you when you started to have suicidal thoughts?
Yeah. So I can't give a concrete example of, when they were the most severe, primarily because I didn't know what SE was, and I didn't have access to any of the tools. But I can give an example of kind of more recent experiences, right? Because oftentimes these thoughts are automatic. They're an automatic response of the nervous system. It's not something that I'm asking for, and thankfully, it's not something that still controls me, and it's not something that I still listen to. So when I notice that there's even the slightest tinge of the thought of, maybe I shouldn't be here, or, maybe I'm not supposed to be here, I do a couple different things. all of them surrounding SE. So the first is doing SCOPE, which is SE's crisis stabilization aid. And it's just slowing down. So we slow down what I'm doing. I connect to what my body's experiencing. I ask it in the moment, okay, what am I afraid of right now? What am I worried about? What is concerning? What catastrophic fear am I trying to avoid? And when I do that, oftentimes I get the answer right there. I'm trying to avoid X, Y, or Z. And then orient. I orient to my space. I orient to my surroundings.
So grounding.
Grounding, yeah, I do grounding exercises, orienting to my surroundings, looking around my space, even looking at it right now. Right, my wife has all these little rubber ducks. Actually, here's one that are dressed like little
Nice.
Disney characters,
Oh,
and they're
I
kind
know
of,
you love Disney
yeah,
from the last interview.
yep, love Disney. Actually, going to go to Disney after this, which I'm really excited about. But that is a big resource for me, is Disney, but it's Disney mixed with my wife. So when I look at these rubber ducks that are dressed like these different Disney characters, provides a lot of comfort, especially when I'm when she's at work or I'm by myself. And then I do an engagement activity. So whether that's actively going to find my cat to pet him or massage him or brush him, or doing a quick workout, doing a quick exercise, right? To mobilize the fight flight energy to come back and shift away from that freeze. And that is how I know that I am far on my healing journey, is I can recognize the trigger, can recognize the experience, and then can downshift it quickly. And for me, that is what true healing actually looks like. I don't believe that these thoughts will never be here, because life is difficult, life is hard. But the thoughts, recognizing that oftentimes they're automatic, and noticing, okay, what is this automatic thought attached to? And then how can I downshift from that experience? For me, is a good sign of healing.
And I'm sure at times, at moments, there are parts that come up. So a part of you doesn't want to, and a part of you does. And it's becoming curious in somatic sessions with a practitioner.
Yeah.
And not pushing down those parts, but just allowing it with a practitioner, with a safety involved,
Yeah.
and becoming curious and allowing them to speak and allowing all your parts to speak. And that would be considered IFS. However, we can also use this in somatic processing sessions. And in somatic processing sessions, if we use parts work, it can be very, very powerful. I know that's how I was able to do a significant amount of my healing, is doing parts work in somatic sessions.
Yeah. Which is something that I do with clients as well. It's very helpful. And I want to address what you just said too, because it's really important, is that in SE, we don't suppress the thoughts. We listen to them.
Exactly.
And that is so healing.
Because when we push down our thoughts, oh, here's my dog.
Hi, little doggy. Hey, doggo.
I brought your cat in, so I'll bring my dog. If we push down our thoughts and we push down our parts, what actually happens is it becomes louder and louder and louder. And until, we may self harm, we may hurt ourselves. And doesn't mean jumping right into it, but if we're having suicidal thoughts, if we're self-harming, we need help.
I just did a workshop for the Asian Mental Health Project here in Southern California, and my presentation was entitled "Making Room for Joy." Because you're right, when we suppress our uncomfortable emotions, anger, anxiety, sadness, grief, we're also suppressing happiness, joy, connection. Exactly. It's not a smart bomb, is what I tell clients. We can't just pick and choose. Okay, I don't want to feel that emotion. I'm just going to suppress that one. When we suppress emotions, we suppress all of them, including the ones that we're so desperate to feel. So it's about healthy ways of experiencing all of our emotions.
And that's being human,
Yeah.
right? It's feeling all of our emotions, right? And what feels different now in your nervous system compared to before you started somatic experiencing?
Oh, it's night and day. It is absolute night and day. Um, I credit somatic experiencing, and I credit all of the wonderful practitioners that I got to work with and all of the wonderful faculty that helped me on my journey. And I feel so fortunate now that I get to work alongside them, alongside some of that faculty, which is just such a wonderful experience for me. But it is complete night and day. Before SE, I would be lucky to feel happy maybe 5% of the day. And now I have so much more expansion in my body. I have so much more capacity to feel joy, to feel connection, to feel happiness. I am a very adamant believer that I would not have been able to connect with my wife in the ways that we did without Essie. Because before Essie, I was very guarded, I was very closed off. And now I'm able to connect and allow that happiness, allow that joy to be, to fully embrace it. And the amount of healing that occurred after SE was astounding. Sorry, said that wrong. It completely changed me in ways that traditional talk therapy couldn't in 5, 6, 7 years.
And how
So for
long
me,
did it take?
with SE, oh, when I really started to get involved in it wasn't until the tail end of intermediate year, like intermediate two going into
Mhm.
intermediate three, for those of us who are, familiar with the SEI format. So I would say it probably took about a little less than a year
Okay.
to really see significant change, and sticking with it, allowing it to continue to be there and to continue to impact my life. The change has been just phenomenal.
And a year is not very long
No, a year
to
is not a long time.
have a significant change in your life. And you continue to do your healing work, though, yes?
Yes, yes, very
Yes.
much so.
The healing journey is ongoing, and we can learn and discover so much about ourselves on our healing journey. And for those of you that are struggling, it could be depression, it could be anxiety, any struggle that you're having, there is help. There is help out there. Dr. Nick is going to be leaving his contact information under below in the comment box. I will also be leaving my contact information to help process your emotions in the body. And I provide a sliding scale. If anyone's interested, reach out. If you're struggling and you're having suicidal thoughts and you're self-harming, there is help. There is healing. There is a better life for you, not just for Dr. Nick. There's a better life for you. Thank you so much for joining, for your raw honesty and being so open and courageous today with sharing such a personal story. You're an inspiration,
Thank you.
and you're a perfect example that healing is possible and there is hope and there is a better outcome. There is a better life for everyone. And I invite everyone to share this video today. I'm asking you to share this video because I've never asked people to share, but today I'm asking because it's such an important talk. It's such an important topic. We need to spread this. We need to have people become more aware of somatic experiencing, embodied processing, any type of modality that's working with the nervous system. They're very, very similar. Embodied processing, somatic experiencing. There's other types of somatic work, and they're basically like brothers and sisters, very, very
Yeah.
similar. With different titles may be a little bit different, but very similar.
Yeah.
And I invite you to become curious of your own healing journey. And if you have family members and friends that are struggling, are self-harming, are having suicidal thoughts, Dr. Nick, one last question. What advice do you have for family and friends? How can they best support their loved ones?
It's a big question. How I have told families of loved ones that have been clients of mine how they can help first and foremost is to not shame, to not
Seems
say
huge.
that is one of the biggest things that a lot of people do, right? Is why are you doing this? Didn't I love you enough? Didn't I provide for you enough? Do not do that. It is not about us in that time. It is about this person. And we want to ask and be open and be curious, what is this person experiencing and how can I assist? How can I help? And for parents, for loved ones, this is going to be talking about it, asking for help, finding resources, finding therapists in your area that can specially help, that can bring this on, that have background and experience, and being open and honest. So often this is a taboo experience and families tend to shut down and close off and they try to solve it, heal it, fix it within. And that's not going to help. This needs a broader reach and we need the proper containment, the proper help. And for example, if there's a sibling that, has a loved one that's doing this, just trying to be there for them in the different ways that we can, right? And sit with them in the sadness, sit with them in the loneliness, and try to be as patient as possible. There are plenty of wonderful books out there, plenty of wonderful resources. I would highly recommend, different YouTube SE channels. Peter's books are also very helpful when it comes to somatic work,
Peter
but
is amazing.
also, yeah, wonderful, amazing person, very, very funny in person as well. Lives here in San Diego too, which is great to kind of have him so close by. But finding the resources in your area, finding the people that can help, and looking beyond the support groups, looking beyond the church groups, looking beyond those aspects, those elements, and really finding, okay, I need someone who has experience in this, and relying on people that have walked this journey before and relying on people that have the expertise to help.
And another good book would be The Body Keeps a Score or Healing Developmental Trauma. Those are two excellent books.
Yeah.
And let's end the stigma because the stigma is part of it. When there's stigma, people are afraid to get the proper healing and help that they need. So if you can, please consider sharing this video and becoming part of the solution to help end the stigma and help people get the healing that they need. Thank you so much for joining today, Dr. Nick.
Thank you.
It was an honor to have you. And thank you, everyone, for watching today and joining in.